Hi, everyone. Welcome to today's on-demand video on the Community Health Center movement, reflections of our origins to address health equity and social justice. Janice Sherman serves as the founder and CEO of Partners in Equity, a nonprofit organization based in Atlanta. She has worked within and among the Community Health Center movement for over 3 decades. As an expert consultant in the health center world, she and her team partner with healthcare and community leaders to advance equity and social justice via models that address the social drivers of health. Janice also assists community health centers and primary care associations with training and capacity building for diversity, equity, and inclusion initiatives. To date, she has assisted countless health centers, over a dozen primary care associations, and provided direct support to the National Association of Community Health Centers. As a further extension of her work, Janice regularly presents to health center staff and governing boards on HRSA compliance and opportunities to demonstrate the success of the health center program. Ms. Sherman has served as a former CEO for two distinct health centers in Georgia, one rural and one urban, as well as the CEO of the Mississippi Primary Care Association. She holds an MPA from the Andrew Young School of Policy Studies at Georgia State University. Welcome, Janice.
Thank you, Jenna. Great to be with you today. I'm excited to share with you regarding origins of the health center movement. And just let me say as a disclaimer that this information is in no way intended to be the sum of all things regarding origins of this movement, but we want to take a look today at some lessons and learning that will prompt us both to reflect on and honor the work of some of the early pioneers of this movement, to take a look back, as well as to provide a little bit of context as we move forward in this work today. So as we seek to define the health center movement, community health centers in this country owe their existence to a remarkable turn of events in the history of the United States and to a number of determined community health and civil rights activists who fought more than 50 years ago, back in the mid-60s, at the height of the civil rights movement. And they did this to improve the lives of Americans living in deep poverty and in desperate need of health care. During this time, we had a group of healthcare and community leaders as advocates across this country, striving towards the common goal to meet the human and social needs for access to healthcare for all people, regardless of their ability to pay. Both of those organized activities and the momentum that spiraled and carried them forward are defined as the movement in that respect, and thus we have the Community Health Center movement. So for those of you who are new staff starting at community health centers, we really value the opportunity to share these origins with you and look forward to your contributions as you are invited to extend this legacy of service. And so I want to take a look back, want you to take a look back with me here for a time in history, as I mentioned, the mid-60s and the 20th century. From about 1964 to 1967, there were elements of racial equity and other social issues that collided with health and access to healthcare in the country. And there were many who were working to transform these systems, such as those you see here in the photo. Here you see two of the civil rights workers who worked there on the ground with many others. These were actually two of the ones that were slain during this time for the work that they were doing to improve access to healthcare. Next, we'll just talk a little bit about the name of this project in terms of part of the origins have to do with what's called the Mississippi Freedom Summer Project. And it happened during this time when goals for securing voting rights for African Americans, healthcare for those in needs within underserved communities, and those of civil rights workers were in demand. So you've likely heard terms like freedom riders, freedom bus, and freedom schools throughout your course in history, but this was a Freedom Summer Project that really spiraled the movement for this work in Mississippi. Many volunteers were also impassioned from around the country to support these efforts as well. And so this work really lends itself to what they created as a body of work called the Medical Community for Human Rights, and they convened around what we know as the meeting for this movement that took place in Greenville, Mississippi back in 1964. One of many of African American physicians, Dr. Robert Smith, who still practices in a community health center as of the time of this recording, had experiences with his home state of Mississippi and the conditions that he found after he returned from medical school at Howard University. He found things like issues of lack of clean water, the intractable issues of segregation, and what resulted in malnutrition and many of the patients in their inability to get prescriptions filled, even though they were giving these out by certain physicians. This group voiced the option that a new institution was needed that would bring about direct medical services, but that would also look at the social service needs like literacy skills and create a comprehensive clinic that would also have those things under one roof. And so we introduced Dr. Jack Geiger, who was a part of these conversations, often led these conversations, and offered a model that he had experienced in South Africa, both as a student and later as a physician. He would offer solutions for what we saw happening there on the ground in Mississippi. And so thus we look at how the narrative sort of shapes in terms of several pioneers of this work. And it's an honor really to be able to reflect on the legacy of many of those today. And so here we have in the top right, Drs. Geiger and Dr. Gibson. I mentioned Dr. Geiger earlier, who was instrumental in not only bringing the best practice of the South African model for the design of the health center program, but also ends up being the one who carries the flag for funding to the federal government when that opportunity is presented for him and Dr. Gibson to do so. And as we honor them today, some have passed away, including Dr. Geiger, who passed away in 2020. We want to further expand on the narrative. There were others that we would like to honor as well. We also have Dr. Cesar Chavez, who was a civil rights activist for migrant and seasonal farm workers, who advocated not only for their safety in terms of their work in healthcare, but also for the social needs that they were faced with during this era as well. Next to him, we have Dr. John Hatch, who was one who worked with addressing the needs for food security amongst things that were happening then. So his work with things like the farm cooperatives in Mississippi actually created avenues for folks to not only gain access to healthy food, but to learn how to grow their food and how to use it. Again, Dr. Robert Smith was the physician who trained at Howard, returned to Mississippi, saw the conditions that I mentioned earlier, and he and his colleagues, Dr. James Anderson and Drs. Aaron Shirley, were physicians there on the ground in Mississippi who were working to bring about this change. In the middle of them, you see Dr. Dolores Huerta, who was a civil rights activist who also worked along with Dr. Chavez, as well as did quite a bit of work to advocate for the needs of migrant farm workers in the country's northwestern section. And to the far right, we have a little bit of a different person involved in Dr. Bob Moses, who worked as a community organizer. He was a young attorney at the time from New York who moved to Mississippi, given the movement that many would be impassioned by based on what was happening there during the mid-60s, and made his contributions as well. Here again, we see Dr. Moses as a young attorney on the left who assumed the ultimate role of making sure that volunteers and others that were in these communities working to advance change were organized in such a way that they were trained and equipped with the information needed to do the right kind of advocacy work for what was happening. And that's him also on the right as a more mature gentleman who has since passed away as well, but very grateful for his work. On this slide, we reflect on some of the things that were happening behind the scenes, like policy change and legislation, which makes its way forward. And so combined with advancing civil rights, Dr. Martin Luther King and others, and President Johnson were working behind the scenes for a couple of years working on strategies to carry out a lot of what President Kennedy had started before his assassination behind closed doors. Their coordination pushed forward the landmark civil rights laws of the 20th century, which would later embody the funding for community health centers. And so here we have the introduction of what's known as the Economic Opportunity Act of 1964, which actually includes the Civil Rights Act, which ends legal segregation and funds social transformation, which is later the legislation that also funds the community health center movement itself. And this body of legislation was also the Voting Rights the Voting Rights Act, as well as other civil rights acts in 1968, which looked at things like fair housing for the underserved. And it was also interesting to note that President Johnson publicly acknowledged during this time as a public school teacher in the state of Texas that he had witnessed firsthand both the racism and the poverty that he had encountered teaching high school students, which really impassioned his work during his time of service in the role of president of the country. And so here you have this convergence of things, the war on poverty, President Johnson signed into legislation, and then you have the Economic Opportunity Act that comes as a result of this legislation to increase government assistance to the underserved. And so as a result of the war on poverty, neighborhood health centers grew in this country, which would later become community health centers. They were established by the Office of Economic Opportunity as a result of this body of legislation, which came as a result of the act itself. And at the bottom right, you see the first rural community health center, one of the first two in Mount Bayou, Mississippi. There was also the companion health center that was named to a public housing project in Dorchester, Massachusetts during this same period. And in Mississippi, they could not name the state placement of this funding because segregation was entrenched in terms of both Congress and within the state of Mississippi itself. The agreement for this funding was that the center would be placed in a rural area or a southern state somewhere in the country, as opposed to naming the state of Mississippi, given deep roots for segregation, both in Congress and in the state itself. As we look both in terms of then and to now, we see we have some of the continued challenges in terms of the future of community health centers and leveraging this work of our origins to grow the program and to continue to serve those most in need. How we really assessed our country's evolution in this program and our own individual collective work for both present and future, so that equity continues to be a renewed commitment to this movement. You are invited to carry forward the legacy of health, justice, and care for all. So with that, we close out today's session, and thank you for your time in this matter. And if there are those of you who would like to really engage around additional work for your centers or to get engaged to further these conversations, you're welcome to view the contact information here. Feel free to contact me at your leisure. Thanks again for your attention today.